ADHD is attention deficit hyperactivity disorder. Some people also call it ADD, attention deficit disorder. It's a condition where children either are hyperactive, inattentive, or a combination of the two. So a lot of people think that ADHD is more common these days than it used to be. Part of the reason for that is because we're getting better at diagnosing it, and I think that more people are recognizing the behaviors. So I don't know that we can necessarily say there's more ADHD than there used to be, but I think we can certainly say that we're better at defining it and diagnosing it and recognizing it so that we can address some of the behaviors for the children. Determining if a child has ADHD can be kind of challenging because at different ages, different children have different behaviors. So a 3-year-old who's bouncing off the walls might be normal behavior, but when your 9-year-old is doing it, it's not always normal. So some of the signs of ADHD can vary. It's the inattention means that the child might have trouble focusing on their work or some of the tasks that they're doing. Hyperactivity might mean a child is impulsive or having difficulty controlling some of their personal behaviors. So when we see some of those behaviors in more than one setting, at home and at school, we consider evaluating a child for the diagnosis. Diagnosing someone with ADHD is relatively complicated. It's not as simple as saying, my child is just really busy all the time. It involves doing some standardized questionnaires in order to assess a child's behavior both at their home and in their school environment. The treatment options for a child with ADHD really vary based on a child's age. A lot of people believe that medication is the first choice, but to be honest, for children under 7, sometimes the best treatment is behavioral therapy, which can be done by a trained psychologist. For older children, there's the option of the consideration of medications, and there's a large number of medications now that we can use along with the behavioral therapy. And sometimes the schools will need to develop a plan to help address behaviors and learning. And those plans are usually addressed via an individualized education plan or a 504 plan. If a parent thinks their child has ADHD or a teacher suggests that they might want to consider the diagnosis, usually the best step is to have a conversation with their family's physician so that the development of a plan to evaluate the child can be initiated. Usually that involves getting some standardized questionnaires filled out by the parents as well as by teachers at school, and then another visit to go over all the forms and determine if the child meets the criteria to define them as having ADHD. And then once you make the diagnosis, you have to decide as a family and what to do with the treatment options.